Hi guys, I am Sarah from Gingerbread Man Running Company. You usually don't see me behind the camera or in the store, but you do see me at all of our local races and special events that we have here in the store or out in the community. And this is our second video for our virtual open house week. And I am excited to be here today with Alicia Bell, Doctor of Physical Therapy at Phoenix Rehabilitation. She is going to talk to us today a little bit about her role as a physical therapist and how that affects our running community and how she can help us. So tell me, Alicia, tell us a little bit about your background and your offices and what services you offer.
Okay, thank you so much for having me. I've been a physical therapist for the past 18 years. I currently practice in our office in Mt.Pleasant, and we also have a location at Latrobe and Indiana, PA. We have 111 locations actually across 11 different states now. But around here locally, I oversee the Mount Lebanon, the Katanning, the Rural Valley, the Latrobe, and I think that's it. So we treat a full assortment of orthopedic, neurological, sports, all ages from pediatrics to geriatrics. And we also do home visits and telemedicine, which we just started once in response to COVID for those that could not come into the clinic physically.
Awesome. That's quite an impressive spread of offices. So speaking of COVID, a lot of people, our runners, are currently training for races that are now either going virtual or unfortunately have been canceled. But a lot of people who didn't run in the past have started running because there's nothing else to do.
Exactly.
And we're trying to be outside as much as we can. So what do you tell people who are training for upcoming races or would like some advice on preventative care? Let's say they have a nagging injury that just keeps popping back up, or maybe they don't have any injuries, but they hear their friends talk about all of their aches and pains and want to stay injury-free. What can you tell us about that?
Yes, that's a very good point. I was thinking the same thing, that so many people are taking to the outdoors with hiking, biking, running, that since gyms had closed and now people are trying these different activities. So it's really important to make sure you're set up for success whenever you start these things. So one of the things that I think is really important is your shoe wear. So I actually recommend here a lot to the Gingerbread Man running store because I know that the patients can come in and they have a skilled person that's going to assess their gait when they come in. And that is the most important, to make sure. Everyone has different types of feet. So you could have low arches, high arches, be a pronator or supinator. And the staff here is really skilled at watching you walk and saying, do you need a stability shoe? Do you need a neutral shoe? Do you need a flexible shoe? So that's one of the best things that I can actually give them a flyer to come in here. And if I or another medical professional recommends to come here, they can get 10% off discount of their shoe wear too. So the shoes are great. That's the first thing, because it's all from the ground up. So if you have good stability in the base, then everything else is going to be set up for success. If they need more specific things at our clinic, we do offer additions just over the counter. So like heel wedges, heel lifts, if there's a leg length deficit. So I can do a musculoskeletal evaluation to see if someone has this leg length difference or if they need additional inserts put into their shoes. And they're really cost effective too, versus having to get a custom made.
Yeah, you did my inserts and
That's
it
right.
absolutely saves my shins and my knees.
Right.
And it's just a great option for trying to stay a little bit more comfortable and injury-free.
Right. Yeah. So that's one thing, is shoe wear. I think other things are getting a good dynamic warm-up program. So making sure you're warming up properly and not just holding a stretch, but moving through the range of motion and actively pumping the muscles while you're getting warmed up and not just holding a static stretch in the beginning. And then there's foam rollers. So if someone's getting a tight IT band, let's say from new running program, they might just need a foam roller to do some self-massage. And that's a nice, easy thing that we can teach them how to do also.
Awesome.
Yeah.
Now, let's say somebody just really gets injured, whether they go to their doctor or not. They have a legitimate injury that prevents them from moving now or running. What do you do for people like that?
Yeah, so we treat things like tendonitis of the shoulder, of the Achilles, patellar, so different neck pain, back pain, kind of a little bit of everything. So some common things you'll get in physical therapy are, well, first of all, if it's tendonitis, you're going to get advice to rest a little bit, which a lot of people don't want
Every
to
runner
hear.
loves.
But truly for tendonitis, you have to rest, ice, compress, and elevate if it's an acute injury. So that's one option for tendonitis. And then you move on to the healing phase. So we do things that help to decrease the inflammatory process. We have electrical stimulation, which helps to decrease inflammation. We have iontophoresis, which is a steroid patch that's topical that goes onto the injured body part and can be absorbed through the skin. You do need a prescription for that, actually, from your doctor to get from the pharmacy for the dexamethasone. But we can do taping, kinesiotaping, to help support that joint. Maybe it's a postural deficit. We use the tools. So the massage, the iStim, it's called, instrument assisted soft tissue mobilization. We use the cupping. I'm going to go over that in a little bit. Self massager with the Theracane. There's a lot of options.
Do you need a prescription to come see you?
Not always. We do participate. I am certified in direct access, and most of our therapists are certified in that. And it's something where you can come for 30 days without a doctor's prescription, actually. If it's kind of a injury that you've had before, or you know it's maybe not that serious, but you just need some advice on stretching, on strengthening, any of those things, you can come and I would evaluate you. And if I find that there are red flags, I would, of course, recommend back to the doctor right away. So I can call the PCP or an orthopedic specialist if they need it to get them into the doctor.
Okay.
But if they don't, if I think it's a condition that we can handle in a couple of visits, it's a great way to get in.
What about insurance? Do you take insurance?
Yes. Yeah, we do participate in pretty much all insurance plans. I don't think there's anything that we're not in network with in our offices. So.
And if you don't have insurance, are you able to do a cash program?
Yes, we do have a self-pay program also.
Great. Mm-hmm. So you can pretty much treat anyone.
Yes.
No matter their injury or ability to pay via insurance or cash.
Right.
That's
and there
great.
is, I forgot to mention, for telemedicine, they are waiving the copays for that right now and the patient responsibility at this time since COVID. So that's a really nice way. If someone does not have access to get into the clinic, they can do a telemedicine visit over Zoom, and there's a lot you can actually do to observe what someone's doing. So we're movement specialists, so we can tell if there's some specific exercise that someone needs to get help with. So telemedicine's another good option.
Awesome. Yeah. All right. Well, I understand that today we are going to be doing a live demo. Do you want to just talk a little bit about it before we bring in our Vanna White of...
Sure. Sure. So today I'm going to demonstrate some soft tissue techniques that we like to use in physical therapy. So I brought our iStim tool we're going to warm up the tissues with that a little bit. So we're looking at tight muscles. And then we're going to do the cupping technique. So we're going to get into that next.
All right. Well, we're going to take a brief break and bring in our volunteer, and we will show you guys all about cupping next. All right. Special thanks to our friend Jen, who has volunteered to have some PT services done on her today. So I'm going to turn it over to Alicia to get started.
Okay, we're going to do a sample treatment of some neck tightness, some upper trap and shoulder blade tightness that needs to be worked out with some of the manual therapy skills that we have and some of the tools that we use in physical therapy. Jen, you can start off by using the Theracane here, which is a great way to self-massage some of the knots that people tend to get in the neck muscles and shoulder blade muscles here. It's a great way to get the muscle warmed up before you get into deeper stretching.
Since you mentioned stretching, that is actually our buzzword today. So if you guys are participating in our raffle at the end of our virtual open house, make sure you write down today's word, stretching. And Alicia has graciously donated one of these tools actually to add to our raffle. So you could have a chance to win this stretching tool.
Yeah, it's great for these knots that you get like right up here. You can actually hold down right on the trigger point that once you locate where it is, hold it down 30 seconds, 60 seconds. And this tool it has different attachment points. You can use it anywhere to self-massage on the thighs, on your calves, on your lower back. The different knobs that you'll see can go in different areas. So there's a booklet that comes with it that kind of shows you all the different ways that you can use it. Okay, and the next thing I'm going to demonstrate is some iStim, it's called. So instrument assisted soft tissue mobilization. You may have seen these tools before. Sometimes they're called Graston tools or iStim. And basically what you do is come along the skin. You just start in an area where it's tight and just glide it along the skin like this. So I'm just taking it down her trap, her right-sided upper trap, and coming down from the neck. And you'll see it start to get a little bit pink in the areas where there's restriction, where there is abnormal tissue tightness, and right away starting to see that it's warming up the tissues here. So you're getting a little bit of pinkness in the skin. And we want to do this to the point where it gets pink, but not red, not bruised. You know, our goal is not to really bruise the skin, but sometimes you get a little bit of broken capillaries. You'll see like a little bit of red dots. But it's a great fast way to break down the layers of fascia to get down into the muscle a little more deeply. So like a deep tissue massage. And we're going to get on and locate where the adhesions are the worst. So after that, I'm going to use some of our cups, these Rock Pod from the company that makes rock tape. So you may have heard of rock taping. These cups are designed by them. And you're going to push this on the skin, just to press it like that. And it's going to adhere to the skin like that. And then you can pop out this. Oops. So we're going to adhere to the skin. And then I can have Jen, we can do some different things with the cups. You can just have them stationary, leave them on for 30 seconds to a minute. That's one form of cupping. And start with the muscle in like a regular relaxed position. Then to progress that, we're going to take her through the range of motion and start tipping away from where the pain is. So she's just moving her head. Her neck restriction is the problem. So we're moving into the restriction while the cup is holding it back like that. So you can see the cup stays in place, her head is moving. And you're going to feel a little bit more intensely whenever we do that, correct, Jen?
Yeah.
Yeah. So it feels a little intense at first, that's normal, but then it gradually, as you're doing it, you'll find that the head can move a little bit further and more range of motion, but less pain during it. And you can go other directions, such as forward. So we're going to take the head forward. I can see she's tight with the forward flexion of the neck too. And that cup is staying in place. So they're made of silicone, so they do stretch with the skin. There are different types of cupping you'll see. There's glass cups, there's plastic cups. Some have a pump that you can pump up the skin up into them. Cupping has been around for about 5,000 years. It's an ancient technique in Eastern medicine that's been used. You can do some shoulder lifting. So just lift that arm up into where you can tolerate it and back down. Just raise. Good. And back down. And it actually became a popularity in this in Western medicine with Michael Phelps in the 2016, I believe, Olympics was when everyone started to see him wearing the cups right after swimming, or you'd see him with the big like circular bruise marks whenever he would be swimming and things. Oh. Okay. And go ahead and relax that, Jen. And then we're just going to peel it off. Okay. And you can see the mark left over from the cup. She has a little bit of a circular mark that it's a little bit of pink, but also a little bit of purple, which is normal. So it looks almost like a bruise, but it's not sore then to follow like a bruise. It actually is not painful like you would feel like on a typical bruise. So then we can go back and do a little bit more eye stim to loosen it back up again.
How long do the bruises last?
It can be anywhere from hours to a couple days. So it just depends on everyone. Everyone's skin type is different. So some people have a lot more sensitive skin. So theirs might last a little bit longer, but everyone will tell you that it's not actually, even if it looks sore, it is not sore to touch. But cupping is great for reducing pain, reducing inflammation, breaking up scar tissue if you've had leftover scar tissue that's been bothersome, as are these tools. It's really great for getting down into scars and breaking up those fibers and helping the collagen to realign in the correct way. So it's just a great tool that we have for returning tissue back to normal. Like right there, you can feel that there's still some knotting right there that we'll work on.
And is this something that you should do on a regular basis, or can just 1 or 2 treatments knock out a problem area?
Oh, good question. So sometimes just 1 or 2 is enough. And it's actually something you don't want to do every day. We usually take a couple days off in between sessions because it really does get the blood flowing. And if you overdo it, it can create a bit of a negative response. So yeah, it's not something to do every day, but yeah, a couple days a week sometimes if it's a real severe problem. But we're finding that people are getting better a little bit more quickly with adding this in. So that's always a good thing. Get people back to their function.
Great. Mm-hmm. And this is a nice way to treat sore areas without the use of prescription drugs.
Correct. Yeah, that's the best part. So it's a really conservative way to treat pain. And the important thing is that we want people back to function as soon as they can and not avoiding their activities. So something I've seen just lately with treating patients has been that people have been kind of in the house for the last couple months and they've gotten a little bit maybe deconditioned. So they're looking to get back to their activities. So whatever we can do to help people get back to strength, get back to activity, then that's what we're going for. So, yeah.
That's awesome. Well, thank you so much, Jen. You feeling pretty good now?
I'm feeling great. Thank
That's
you.
awesome.
Thank you. Thank you, Jennifer.
Alicia, is there anything else you would like our running community to know?
No, just basically if you're having pain, don't wait. The longer you wait, sometimes the longer it takes to recover. We can do things right away and help you keep out there and keep running. So that's our goal, is to keep you moving, keep you in shape, keep fitness going. So
Awesome. Well, thank you so much. Again, this was Alicia Bell, Doctor of Physical Therapy from Phoenix Rehabilitation, and we will post her information on how to contact her and make an appointment very soon. Thank you so much, Alicia.
thank you so much for having me.